Okay, so addiction. Before I start, I stumbled upon an article that was written by Dr. Gabor Mate, who is a Canadian doctor. I think he may be retired now and strictly as an author and speaker, but he worked in East Vancouver for most of his career treating what he would call hardcore addicts, okay? And some of the things that his books have enlightened me to really helped with my practice, really helped me sort of understand the population base that I was working with. So when it comes to addictions, he says, there's a significant way in which early experiences shape adult behavior, and even especially when there is early experiences for which there is no recall memory. It turns out there are two types of memory. So there's explicit with an EX. This is the type of memory that you can recall facts, episodes, details, and circumstances. But the structure in the brain called the hippocampus, which encodes recall memory, doesn't begin to develop until we are 18 months old and doesn't fully develop until much later, which is why practically no one has any recall memory prior to the first 18 months of life. Okay? So that's your explicit. That's you'll remember today, you'll remember some of the things you learned today, where you got your massage table from. Okay? So the second type is implicit, IM. Implicit, which is in fact an emotional memory, where the emotional impact and the interpretation that the child makes of those emotional experiences are ingrained in the brain in the form of nerve circuits, ready to fire without specific recall. So to give you a clear example, people who are adopted have a lifelong sense of rejection very often. They can't recall the adoption, they can't recall the separation from their mother. There's nothing there to recall with, but the emotional memory of separation and rejection is deeply embedded in their brains. Hence, they're more likely to experience a sense of rejection and a great emotional upset when they perceive themselves as being rejected than anybody else. That's not unique to people who have been adopted, but it's very, very strong in them because of the function of this implicit memory. People who are addicted, given that they, according to all the research literature and by experience, the hardcore addicts, virtually with all have been significantly abused as children or suffered severe emotional loss. Their emotional or implicit memories are those of a world that's not safe. It's not helpful. Caregivers are not to be trusted, and relationships are not safe enough to open up in a vulnerable way. Okay. And so, there is a response to keep to themselves, separate from really intimate relationships, not to trust caregivers, doctors, and other people who are trying to help them. And generally, they see the world as an unsafe place. And this is strictly a function of implicit memory, which sometimes has to do with incidents that they don't even recall. Sorry, a little bit. Makes me think of people I've helped over the years. So when we're talking about somebody who's really addicted, now of course there's always going to be a huge pendulum. I'm sure if Mary Lynn went around and grabbed everybody's cell phones and told them that you could have them back on Tuesday afternoon, there'd be a little in the kidneys. You'd feel a little adrenaline rush. You're like, what are you talking about? No, it's my schedule. It's my life. It's everything I do. So it's not necessarily that you're a hardcore addict, but we all have little things in our lives that may swing that way. So when we are treating somebody who may have severe addictions that we're aware of, or they've made us aware of, we have to understand that, especially in that first instance when you're meeting them. I remember, we'll call her Bev. She was one of the first patients I ever treated at the Homewood. She was there for addictions, but she had found out why she was addicted, which was due to prior trauma. So she was going to be moved from the addictions program, which is about 4 weeks long, the standard 28-day program, into the trauma program afterwards. So it was suggested to her by her team that she come down to reconnect with her body, to get this treatment. She had never had massage therapy before. She had abuse issues, and she was coming off of drugs. So this was about 2 weeks into her initial treatment. And Bev was about maybe 4.5 feet tall. When she sat on a chair about this size, her feet would swing. That's how small she was. So as soon as she met me, and I was going to stand on the stage today, but I didn't want to be too imposing, I'm a big guy, 250 pounds, 6'3". So here's little Bev, abuse survivor, addict, coming with me to the basement of a hospital that is for addictions and mental health disorders. As she comes down, of course, she knows that, I wouldn't be there if I wasn't a professional. She knows where she's at, but still, as we go down and descend in the basement, there's no windows. To get to the clinic was a couple rights and a couple lefts. So once you've done it a few times, it becomes very straightforward. But in the beginning, you're completely disoriented. You have no idea where you are. So I close the treatment room door, and she sits down, and I can see her eyes are this big. She looks over at the wall. There's a phone jack, no phone. There's no panic button. There's no TV. There's no way for her to do anything if something goes wrong. And it wasn't until a little while later that I realized as massage therapists, we're salespeople. We don't like to think we're salespeople. It's like, I got into massage because I don't want to sell cars, houses. I'm not a salesperson. Let me tell you this. I had 7 steps of consent to get her on the table in the most vulnerable position she possibly could be, mostly naked, under 6 millimeters of sheets, face down, so if she screamed, nobody would hear her. I managed to do it. So treatment went off without a hitch. She came out afterwards, had a couple tears in her eyes, said, "Thank you so much. You've completely changed my world." And that's very powerful. Because when I got into massage therapy, I always thought it was we're sort of on the outskirts. If we were at a wedding, we'd be at the table with the Reiki therapist and the touch therapist, and there'd be somebody with like 56 crystals on the table. The surgeons would be at the front, psychiatrists would be at the front, we'd be eating hot dogs and fish sticks or something. So for me to have that experience with this person was awesome, because she gave so much trust to me in that moment, having only known me for a couple minutes. And it completely changed, she told me later, it completely changed her entire treatment there at the hospital. It was one of the highlights of her stay there, because she knew that she could look forward to it. So when she was in group and they were asking her, you got to open up, Bev, you got to open up, she was able to open up a bit more because she knew that she was going to come see me. So Thursday I'm going to see Chris. So I know they might ask me some tough questions in group, but I can let it out because I can go down there, listen to Enya, some other strange music. There's no windows, there's no phone, there's nobody to bug us, and I can just relax for 60 minutes. Very, very powerful. The 3 groups that I'm going to talk about, very underserviced, mostly because of what I just read from Gabor Mate's excerpt. Most of these people don't trust caregivers. A lot of them have suffered abuse from caregivers. Okay, a lot of them come from a past where they might not have been as privileged as some of the rest of us, so they just kind of got bumped around from broken homes, foster homes and things like that. And Shannon was saying it, everybody's been saying it today. Don's been saying it, Paul's been saying it. You have to go out and actually reach out to these groups. It would be great to say, hey Chris, could you contact, the Canadian Mental Health Association and tell them that I'd really like to start working with people suffering from mental health illness, and could they send me some flyers and things? I can't do that. You have to do that. You have to reach out to these groups. And we'll get into it a bit more a little later in the talk, but just start thinking about that from that standpoint. It's a very underserviced demographic. Unfortunately, these things are growing. Some of the stats I have that I found, they're a little outdated. I couldn't find anything very current. I did look and I did try. So I think they're slightly outdated. But you have to remember as well, people who are suffering from addiction, there's probably something else going on in the background. There's probably some other mental health issue that's happening. So if somebody comes into your clinic and tells you that they just started AA or NA, and they're working through the process, the first 12 steps, you might want to educate yourself. Just go to websites. You can go to Narcotics Anonymous. You can go to Alcoholics Anonymous. You can find information just to educate yourself a little bit about who's on your table. Okay?